ask me if they are a good candidate for eyelid surgery. So eyelid surgery helps with the droopiness and sagging of the upper eyelids. A good candidate is somebody who's bothered by the appearance of the droopiness of their upper eyelids, or if the upper eyelids are drooping so much that it's actually blocking vision, if it's obstructing peripheral vision on the sides or above. As long as the eye is healthy and there's no significant dry eye, then that's what makes a good candidate for upper eyelid surgery. How is lower eyelid surgery performed? When we do surgery on the lower eyelids, we make an incision behind the lower eyelid so that we don't have to make a skin incision going through all the layers. We go down to where the fat pockets are below the eye that create puffiness or bags in the under eyes. And we have techniques to smoothen out those fat pockets, typically by repositioning the fat or draping it down into the tear troughs. That way we can smoothen out the hills of the lids. Sometimes we'll also make a small incision right underneath the eyelashes to tighten the skin at the same time. Are there any non-cosmetic reasons to get eyelid surgery? Yes, there are. Sometimes the upper eyelid skin is so droopy that it folds over, presses on the eyelashes, and gets in the area of the pupil to obstruct vision. In those cases, eyelid surgery, by removing the excess skin that's blocking the pupil, will open up the peripheral vision so that you can see to the sides or above. Imagine when you're driving a car and you're in a situation where cars are coming from the side, you'd be able to see those much easier. Also, taking the hooding away can brighten your vision and give you better quality vision. So those are non-cosmetic reasons to consider upper eyelid surgery. How is upper eyelid surgery performed? Well, we make an incision in the natural crease of the eyelid to hide the incision. We taper the incision out to the side here. We remove excess or redundant skin. Sometimes we'll take a little bit of the puffiness in the corner of the eyelids away, since that tends to worsen as we get older. And then we put a row of stitches to close the incision. Patients sometimes ask me, why should I get eyelid surgery? When the upper eyelid is sagging or drooping, or when the lower eyelid is puffy or the skin is crepey, a lot of times that gives somebody the appearance of looking tired or sad. The reason to get eyelid surgery is if you're bothered by that sad, droopy, tired appearance, and you want to give yourself the version of yourself where you look rested and your youthful self.